Hi, today we're going to look at what to do if a child went unresponsive but was still breathing. So I've got Bob here and he's going to help me out so I can explain to you what the ideal way is to make them safe. So imagine that your little one, and when I talk about a child, we're talking about from the age of 1 up to puberty, around about 12 years of age, with regards to this session that I'm looking at today. So the first thing we always want to do, you may have heard of the letters Dr. ABC, Dr. ABC, and this is what we call the primary survey, is to guide you at which stage that you need to do things. So let's look at the first one. D is for danger. We need to make sure that it is safe for us to approach the child. Imagine they've just been knocked over by a car when they were riding their bike, or maybe fell off a wall, or any other dangerous situations. We've got to make sure it's safe for us to actually go and help them. That's number one. Number two, we want to find out if our little one is actually, maybe they're sleeping, but maybe they're not. So at this age, it's okay for us to give a little bit of a shake to the shoulders. And if you know the name, then you can say it. If it's a stranger that you saw an injury happen to when you were walking down the street, it'd be great if you could help. So I'm just going to give a little bit of shake. Bob, can you hear me? Bob, can you hear me? It's Sarah. Can you hear me? There is no response at all. They're not opening their eyes. They're not able to move. They're not talking to me. Nothing. Child is now classified as unresponsive. Let's have a look at the ABCs. So A is for airway. Now, this is what I'd like you all to do. I want you all to try and put your head all the way back as far as you can, as if you're trying to look over the back of your head. Yeah? Now try and swallow. You either can't or it's extremely difficult. Why? Because when we tilt our head all the way back like that, what we do is we lift our tongue off the back of our airway. And that is now our airway open. But when somebody is unresponsive, every single muscle in their body completely relaxes. It's what we call dead weight. So the tongue is a very strong muscle. It will also relax. The problem is when you're unresponsive, the tongue will block the airway. So we have to open the airway. So let's do that. Now with a child or an adult, it's exactly the same technique. All we're going to do is put one hand on the forehead and two fingers under the chin, and we call it that head tilt chin lift. And once you've done that, you've now lifted the tongue off the back of the airway. Now it's the time for B, which is breathing. Now we want to see if the child is breathing. It's exactly the same for an adult as well. So I'm going to get my head down and I'm going to look down the stomach. And what I'm looking for is rise and fall and rise and fall, nice and steady. I will also hopefully be able to hear them breathing and feel that they're breathing on my face. And I'm going to do this for 10 seconds. So let's do that. Make sure you keep hold of the head though. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. If the child or adult is breathing, that's great, but it's still an emergency because they're unresponsive. If there's somebody with you, get them to call 999 straight away. If you're by yourself with the person, let's make them safe first. So all we want to do, ideally we want to pull them towards us, but for demonstration just now, I'm just going to say make sure that they are completely onto their side. And when you've pulled them onto their side, you also want to make sure that you have got the airway open, and it will stay open in this position. So that's the Dr. A, B bit. But what about the C? Imagine, well, not imagine, it's a fact actually. What does your heart do? It beats, it pumps blood around the body, and blood carries oxygen. So your circulation keeps all of everything perfect and harmoniously, if you like. But what we're looking for here in the primary situation is if there's been any break in the circulation, as in blood loss. And at this stage, if you saw blood coming out of that child or adult, you're going to grab wherever you can. It could be a towel, it could be a hat off your head, it could be anything. And it just so happens that I've actually got a towel here, and that wasn't on purpose. So you're just going to put direct pressure onto that break in the circulation. And if you are by yourself, this is the time to go and get your mobile phone and call emergency services 999. And you're going to stay, of course, with the child or adult to continue to reassure them and just keep checking that they are still breathing. Now, why do we put anybody into recovery position? Because there is no muscle tone in the body. They are unable to swallow their own saliva, or if there was any vomit or regurgitation. If that was to happen, then in this position, gravity can help us and it would be able to drain out of their mouth. If we left a child or an adult on their back, what would happen is that saliva regurgitation would just build up and build up and build up, and they would choke. That is why we always have to get anybody, regardless of age, into the recovery position. So one last time, we're going to get them onto their side, number 1. Number 2, make sure the airway is open. And number 3, have a look around the body to see if there's any obvious signs of bleeding. If there is, stop it. Call 999. They will stay with you on the phone until emergency help arrives. I'm Sarah Phillips, and I hope you've enjoyed or found this useful, this little video. And if you want to put yourself onto a first aid course for babies and children, then pop over to my Facebook page, Mini First Aid Aberdeen and Aberdeenshire, and you will see all of the scheduled classes there. Look forward to seeing you. Have a great week, guys. Bye-bye.